Hi, my name is Dr. Phil Memoli, and we're here to discuss dental pain and hidden causes of dental pain and biological therapy which could be done. The main thing to remember here is that when you have dental pain, it will probably keep repeating itself unless the cause is done. I'll see people walk into my practice with 3, 4, 5, or 6 root canals and say, I want to stop this progression of root canals. So how does this all start? It starts when you get pain in your tooth and you go to the dentist and they basically say you need a root canal. So the question is regarding root canals is, when is a root canal indicated? What is the diagnosis for a root canal? Because pain is not an indication or the diagnosis of root canal. A dead tooth is. At what point does a tooth need a root canal? It typically needs a root canal when the nerve inside the tooth is dead. How do we diagnose whether the root is dead? Well, one or two important studies came out and said pain is not an indicator of the liveness or deadness of the nerve. We can't say, okay, I'm having excruciating pain on this tooth, we need a root canal. Because I've seen people get the root canal and still be in excruciating pain. The root canal wasn't the solution. What was causing the pain? We need to diagnose the source of the pain. There is this test, the pulp test. The pulp test allows us to test the tooth and see if the nerve is alive. Not only does it allow us to see if the nerve's alive, but it tells us something about the quality of the nerve. So if the nerve reacts too quickly or too hyper, then we know that there's inflammation going on in the nerve. So then it becomes what's causing the inflammation in their nerve. If the tooth doesn't respond to the proper stimulus or takes too long to respond, then we can say there's something in this nerve that is slowing down or dying, and that's degenerative changes in the nerve. This pulp test, it's rarely used in dentistry, but it gives us a lot of information about your nerves. There are provocation tests, hot and cold. The provocation test, it's the same matter. If I put hot or cold on the tooth and it responds immediately, that's indicative of inflammation. It's not indicative of the tooth dying. If the tooth doesn't respond, some teeth don't respond. So it's not indicative. So there is no definitive test that tells us that this tooth needs a root canal. The other test that's frequently done is people go in and the dentist taps on the tooth and says, and you say, ow, I feel that. And they say you need a root canal. That test is called the percussion test. The percussion test boils down to one of two diagnoses. There's around each tooth there's a ligament. So you either have ligamentitis on that tooth or you have inflammation in the nerve. So there's two different aspects. And if there is ligamentitis, that's more or less being caused by either you chewed on something too hard on that tooth or there's a bite problem. So regarding dental nerve pain, if we have a tooth which is in pain, but the nerve seems fine, we have to figure out where is that pain coming from. So is it localized or is it systemic? So in looking at that, what are the local causes of tooth pain? One would be a deep cavity in the tooth. So we would look on the x-ray. The other would be a filling that's very close to the nerve. Another cause could be a large filling, say a tooth that had a very large filling and should have been crowned, but instead of crowning it, a filling was put in, and that filling from stress from the bite is now creating a situation that's harming the nerve. So if we look at the x-ray and see one of these, local, but if we look at the x-ray and we don't see any of these things, then our next thought is systemic. Now the x-ray can give us a hint that there is a systemic issue. How? Well, when we look at the actual nerve, there's two parts to the nerve. There's one part that's called the pulp, that's inside the tooth. Then there's another part called the canal. Okay, that's where we get the term root canal from. It goes through the root. If these are normal size, versus if they're small. Okay, normal size tends to imply that we're getting good nutrition and that there's not a lot of clenching or grinding going on. But if these things are there, okay, if we look at the tooth and say, you know, we don't see any of the typical things that harm a tooth, but I am seeing nerve degeneration. I am seeing maybe 50% or 25% of the actual nerve size left. Let's talk about clenching for a minute. Clenching is another interesting thing. When I ask people how is their nutrition, they say fine. When I ask people do they clench, they say no, I sleep with my mouth open all night. Well, the studies done on clenching have shown us that 90% of people shown to clench believe they don't do it. So this is something we don't do. Well, my husband sees me all night and I'm sleeping with my mouth open. Well, yes, at certain times in the sleep cycle, you have your mouth open, and other times you're grinding away. Systemically, these boil down to two major problems. One would be systemic, one would be nutritional. The nutritional fact is sugar or food addiction. And this causes nerve damage in the mouth, and it also creates nerve damage in the brain. And I discussed this at length in my sugar addiction YouTube video. The systemic factor would be something we call myofascial. And what myofascial means is that there is a neuromuscular dysfunction of your muscles. And this tends to occur in the upper back, the neck, the shoulders, okay? And people with this have constant pain, low-grade pain in their shoulders. They also sometimes have their shoulders or their head posture move forward. In the long term, this creates clenching. But what happens is these muscles, when they're in spasm for a long time, they create a phenomenon called trigger points. These trigger points, you can feel them. When you press on the trigger point, it refers pain to another part. So these trigger points can create headaches in different parts of the head. They can also create toothaches. So I can have a trigger point here creating a toothache here. So we need to diagnose this. Otherwise, a root canal is being done for no reason, or a tooth's being extracted for no reason. You can press on there, and if you don't get the referral, some people are now calling that a low-grade fibromyalgia. Okay, so it's possible to have myofascial pain and dysfunction or fibromyalgia in your neck, shoulders, affecting your jaw muscles, causing TMJ, causing headaches, and also causing you to grind. And what happens when you grind? What is actually happening? How is that affecting the teeth? Well, when we're clenching and we're putting pressure on the teeth, blood is not going into the tooth. This is called ischemia. And what happens is when we have a tourniquet put on our hand, when the tourniquet's on, we're not actually getting pain at that point. When the tourniquet comes off and the blood goes back into the tooth or back into the hand, then we get the pain. So one of the questions is, did it wake you up at night? And to some people, that's indicative that you need a root canal, but that's indicative that you're clenching at night and no blood is going into the teeth. And what happens when you wake up in the morning? You wake up in the morning and now I have a toothache. Okay, because now the blood is going back into the tooth and you're getting tooth pain. Well, no, the pain didn't start till 3 o'clock today. Okay, well, what's happening? You're clenching your teeth during the day. And what are the signs and symptoms for that? Well, generally, the tooth was hurting yesterday, today it's fine. Okay, or it's hurting in the upper right. I can't isolate it to one tooth. Now, some people say, well, no, it's localized. It's this tooth, it's doing it. Well, if you're clenching on the same tooth all the time, that tooth's going to start to hurt and show symptoms. So we have damaged dental nerves, and how do we treat them? In my practice, the biological approach is a triad. We're doing local dental treatment. There's going to be some form of nutritional therapy, and there's going to be some form of systemic therapy. So this triple approach tends to help resolve this problem for the long term. What we actually have to do is ask some questions and try to ascertain this. Is this dental nerve reversible? Is the damage reversible, or is it irreversible? Is there enough nerve left for the nerve to regenerate itself? Is the pain interfering with the person's life? If the answer to the first two questions are yes, but the pain is interfering with the person's life, we may not be able to move ahead. This may take time. Sometimes this happens overnight. I'm treating people who are in excruciating pain, and I think they're going to be in pain for a couple days. The next day we call them up. They're fine. It went away. But there's other patients. We've had several cases linger for weeks. And these are primarily people who can't shut off inflammation. So that's not the general population. How are we going to treat this? One thing we want to do is we have to stop the pressure on the tooth. Okay, so that's step number one. We may have to make a mini mouth guard. Step number two, we administer remedies. What's going on inside the dental nerve? There's inflammatory or degenerative processes going on, and these can be addressed with homeopathic remedies. The other aspect of this is when degeneration starts, bacteria come in to assist the body. Some people call this infection, others call this bacterial assistance. We need to help control this with some ozone. There are a lot of dentists who feel ozone is a pan-systemic therapy. It can solve every problem, but you also have to remember that ozone, like any other modality, can create resistant infections. So there are ozone resistant infections. Then we actually have to either address the nutritional component and the systemic component. The nutritional component is going to be what is damaging. Is the person eating something that's very stimulatory to the nervous system and causing it to overreact? Or is the person have a sugar or food addiction? The myofascial therapy involves what's going on in the shoulders, the neck, those sort of things, okay? And that's done through myofascial therapy. The other aspect is when that myofascial therapy starts having the impact in the mouth, it impacts the actual cranial nerves in the mouth. And there's something called neural therapy that's very effective for resetting the nervous system in this area. It can impact the body's acupuncture system. So the acupuncture system has to be reset with oral acupuncture. Dental nerve problems. What's our success rate? Teeth that are in pain that are alive. It looks like at least 2 out of 3 of these teeth can be salvaged. But it's not a simple quick fix like a root canal. It involves multiple visits, multiple therapies. At the end of the day, we're not just treating the one problem. We're treating its cause and preventing future pain, future dental problems, and future problems for our general health. I hope you enjoyed this series, and if we can be of any further help, please give us a call. Thank you, and have a great day.